Well, Essence, here we are. Thank you so much for taking the time today. I have to say before we get started, I sure wish this conversation was happening in person like the last one in Tampa. How are you today?
Hey, Chris, I'm doing well. It's nice to see you. And I don't know that you really would want this to be in Tampa because it's really hot here right now. But as always, it's great to see you and to be able to engage with you.
Absolutely. Thank you so much. And to our future audience, thank you for jumping on and listening in to this fireside chat. By way of introduction, my name is Chris Lynch, Director of Strategic Accounts here at Vim, a technology company that's helping organizations like Yuvo Health enable their provider partners and solve last mile data delivery and interoperability challenges. Before we jump into today's conversation, we wanted to note that on August 28th, Yuvo Health and Vim will jointly present on a panel at the Rise West conference in Dallas, Texas, that we are very much looking forward to. Ahead of it, and with today's fireside chat, our goals are to give you all a preview into that conversation, share a bit more about the value-based care space from a leading innovator, which is Yuvo Health, and of course, highlight how our partnership serves to advance Yuvo's important mission. From here, it's of course important to introduce our guest speaker for today, Essence Williams, the head of risk adjustment at Yuvo, and Essence give you the opportunity to share a little bit more about your story and background.
Awesome. Thank you, Chris. So as you stated, I'm Essence Williams. I am presently the head of risk adjustment at Yuvo Health. A little bit about my background. I've been a registered nurse just shy of 20 years. I spent the first half of my career at the bedside in critical care, eventually transitioning from the bedside to more hybrid roles that allowed me to wear my clinician hat in an administrative role, as that was really where the influence was more attainable. I really wanted to be the change that I wanted to see, and I wasn't able to necessarily do that just in the clinical space. So here at Yuvo Health, my team and I are responsible for working hand in hand with our FQHC partners, supporting and advocating for them as they tell their patient stories, while ensuring that the disease burden that each patient carries is acknowledged and accounted for. That's my story.
It's a great story, and one that really resonated, especially in the last time we met, around the mission that you all are on at Yuvo and the mission alignment and the drive that you all have, especially around the team that you're building. I wonder if you could hit a little bit more around that particular mission and the DNA of the team that you all are assembling and that's driving it forward.
Absolutely. I want to add a little bit more context to my background, right? Because it's important because it really aligns with that mission and the values that all of us here at Yuvo Health have. So my early years of nursing really shaped me as a person. I was only 20, I was still a baby. And there are a lot of things that were happening around me with my patients and their families. And it really struck me because there were so many disparities that were just blatantly apparent, right? Things that really made me question my humanity and the things that were happening and how they could happen. So the time that I spent at the bedside really shaped me for what was to come. It's like, I don't know how to describe it. It's just something just sits in you and you're like, okay, at some point I have to act on this. There's something that I need to do. I eventually left the bedside. I landed in risk adjustment. Someone took a chance on me, spent some time under some very strong leaders. And I learned a lot about myself and a lot about how I could be the change that I wanted to see and impact. So the head of risk adjustment role with Yuvo Health came along at a time when I was really feeling unfulfilled, I guess, as it related to my purpose of serving others, especially those who are underserved for reasons that were truly outside of their control. So Yuvo Health was founded by 4 courageous BIPOC leaders who experienced firsthand how transformative it was for them and their families to have access to FQHCs. They set out to make healthcare equitable in those areas that needed the most. Yuvo Health exists to support federally qualified health centers, also known as FQHCs. Our mission is to ensure every health center can provide compassionate care to their entire community. Our promise is to stand behind health centers as they scale their reach across their communities while continuing to deliver the highest quality of care. We absolutely pride ourselves on this. Yuvo Health allows for the leveraging of payment systems, scalable infrastructure, and partnerships that will allow for a meaningful seat at the table within the value-based care ecosystem.
Great. And you mentioned the value-based care ecosystem. Maybe we'll transition into that topic next. I think what our audience here is likely very familiar with is the advances and the accelerating approach that's occurring in the traditional Medicare and Medicare Advantage spaces. They may know a little bit less about the state of value-based care in the area that you all are focusing at Yuvo. I wonder if you might want to share a little bit around the Medicaid space historically, what you all are looking to bring to FQHCs as well.
So let's level set. A federally qualified health center is a center that provides comprehensive primary and preventive care to patients of all ages in underserved and rural areas. FQHCs must accept all patients regardless of their ability to pay or their healthcare status. According to the Health Resources and Services Administration, also known as HRSA, 1 in 11 people across the United States rely on FQHCs for care. It is estimated that 1 in 5 patients are Medicaid subscribers. While FQHCs are essential in healthcare, the reality is that they face many challenges. Wait times can be lengthy, and there is typically a higher than normal turnover of providers, which can impact continuity of care delivery. Despite these challenges, FQHCs play a major role in ensuring equitable care for medically underserved populations. A challenge for many FQHCs is that of having equal playing field as it relates to value-based care contracting due to different variables that are outside of their control. As a direct result of these variables, FQHCs are often overlooked for participation in VBC arrangements. Yuvo Health recognizes and understands the transformative benefits of VBC and FQHCs and what is needed to move our FQHC partners along the continuum of VBC. Yuvo Health has worked to codify this understanding through our contracting and managed service organization offerings that exist to position our partners for success.
Well, I certainly think that will resonate, especially with our payer audience around contracting and some of the value proposition that Yuvo is bringing to the table. I wonder if we might now transition over to how do you design your risk models and risk adjustment programs as another key factor to the offering?
So I think this question, it's a little bit more, right? So the question might be, the add-on to that is, do we look at FQHCs and customize how we approach them risk model, risk adjustment wise for the programs? Or, do we have a blueprint that makes sense for everybody, one size fits all? And the answer is that it's both, really. There are some very well-known, tried and true risk adjustment foundational strategies that must be implemented to ensure the success of any program. You can ask any risk adjustment leader across the country what the minimums are, and I can assure you that we would be aligned. Once our foundation is solid, though, we can move forward to incorporate different offerings from our toolkit that best fit the specific needs of the specific FQHCs that we're working with. So it's really very, it's foundational, because foundation is everything. And then there's curating those things that you identify with your FQs and their providers to ensure that they are operating optimally when we talk about the documentation and the coding and the articulation of the illness burden of the patient population that they're serving.
Great. And my sense is that background there will resonate really, really well with our broader audience. And as we think about the Rise Health or the Rise West conference here upcoming, I think that will be a key piece that will come forward even further. So we've now spoken a little bit about value proposition, contracting, models, and programs. What we often hear from other leaders like yourself is where these things can then fail is around execution and, more importantly, around change management. I wonder if you could share a little bit more around what you think of change management, what you see are some of the pitfalls, and maybe some of the ways that you lean into it to move these initiatives forward.
Absolutely. That's a great question. I'm going to lean into what makes change management successful from my perspective. Engagement, relationship building, consistency, communication, making sure that the actions that are being displayed align with the words that are being spoken, showing up when others can't, don't, or won't, supporting and advocating for the change that we collectively want to be and see, while developing the policies and procedures that will best support that change, right? All these things are critical to successful change management and adoption. And I think it's really as simple as that, right? I'm sure others will argue with me on that, but it's really those things, the core, the foundation of being able to connect with folks, have an understanding, be on the same page, meet them where they are, and the rest of it will fall into place.
Absolutely. It certainly will. So maybe now piggybacking off of successful change management and looking ahead and thinking about the Yuvo and Vim partnership, could you share a little bit more about the experience for FQHCs before our partnership would be in place? And now, as we look ahead, what a more streamlined operational approach might look like?
Absolutely. So prior to Vim technology, a lot of the work that is being done elbow to elbow with the providers is manual. It's absolutely manual. Identifying opportunities, discussing the articulation of the illness burden to the highest specificity, talking about the importance of that, right? Caring for the patient at the end of the day, that's why we are all here. And so the way that we were doing this historically was very manual. We would identify the opportunity, we would have the conversation with the provider, which is super important, but the takeaway would be something along the lines of, I'm going to follow up with an email or some type of documentation for you to review at your leisure to complement the conversation that we had. And it's inconsistent at times because providers are busy, especially in the FQHC world. They're often a bit understaffed, and so they're super, running around trying to make sure all the patients get everything that they need, while also trying to fill their own, selves so that they can continue to push. With the Vim implementation, we're being intentional about leveraging it to provide that needed information at the point of care. It is electronic. It's not outside of the EMR. It's not another click for them. Instead, it's right there, real time. It's the content that we would have been communicating manually, in addition to the conversation, but now it's right there for them to say, oh, I see what you're speaking on, and here it is, right? So ultimately what's happening is that the technology that Vim is bringing to the table is allowing for us to collaboratively remove a portion of the administrative burden that plagues our FQHC partners. And it's a true value add that offers the source of truth, again, at the point of care, which is, I think, one of the most critical things that providers speak on all of the time. I just want to see my patient. I just want to be able to see what I need to see on one screen, cover that, and the day be done, right? So I think that it's really going to be a value add, and it's going to be something that takes away from that heavy lift for those providers who are caring for the community on a daily basis.
Absolutely. Well, I know I speak on behalf of the Vim team. We're very, very excited about the partnership and supporting you all as well. And maybe more broadly for today's conversation, thank you so much for sharing a little bit more about your story, the Yuvo story, and where this all is advancing. For our audience today, we're looking forward to seeing a lot of you August 28th in Dallas at the Rise West Conference. But for now, thank you again. And Essence, thank you. Have a great rest of the day.
Thank you so much for having me.